Hello, this is Dr. Gay from First Lake MRI, and this is a 30-year-old female with complaints of slurred speech, blurred vision, confusion, disorientation, abnormal fine motor skills. She's got extreme fatigue, difficulty waking up, and other problems. So she got some very significant clinical problems, but her MRI of the brain looks very good. We just found one thing in her brain that was probably incidental. So no explanation for her very significant symptoms, but here we see a little fluid collection. This is in the pineal region, and this looks like a pineal region cyst. Now these are very common. We see them in maybe 5% of people, and usually they stay the same size, and they usually are asymptomatic. So we've learned to not need to do follow-up on these because they're usually stable when they're small and don't cause any trouble. But if they're over 1 centimeter, or some people say 1.2 centimeters, then it can be difficult to tell if it's just a benign cyst or if it's a cystic pituitary tumor like a pinealocytoma that can look identical, and the cystic tumor can grow over time and cause trouble. And so if it's big like this one, or over 1.2 centimeters, it may be wise to follow these just to make sure they don't grow. And you can give contrast. Usually the contrast will cause a thin rim of enhancement around the periphery. Sometimes it can be a little bit nodular, but usually thin rim of enhancement and delayed imaging with contrast. If you accidentally don't image right away, the contrast can infuse into the cyst and look like a solid lesion. So why do we worry about these cysts? Well, sometimes they can get bigger over time and push down on the tectal plate. Now most of the time they stay the same size. A very small percentage, 3% or so, may slowly grow, and if we have a small lesion, we just don't worry about it. If there's something bigger, we do worry that if it grows a little bit, it may cause obstruction to flow of CSF, and so we'd recommend maybe follow-up. But the time interval is not set, and it's even controversial. Some people say don't follow them, just if they have clinical symptoms, then follow them. Don't waste time and energy, and people are stressed out when they have to have an MRI in a year. So it is controversial, but think about over 1.2 centimeters is the threshold to start to get a little bit worried, and anything smaller than that, have some confidence. So you can just let these go, mention them, and but if they're nice and simple appearing cysts, then they can just be followed clinically and give them the comfort to know these are probably just incidental. Again, a 3-to-1 female to male ratio, and again, these are seen in about 5% of people, just incidentally, like probably in this case. So this is the cyst. There's a little plate below it, this little band. This is called the tectum, or the tectal plate. The pituitary cyst sometimes can push down in that tectal plate, and there's a little channel beneath the tectal plate and above this thing, which is the midbrain. This is called the Cerebral Aqueduct, or the Aqueduct of Sylvius. And this is a little channel that communicates between the third ventricle, where the fluid flows to the brain. Fluid is flowing all the time. This is the lateral ventricle. It flows out of that into the third ventricle, and it goes through this little channel that's barely discernible into this fourth ventricle, which is a little bit bigger, and then out down here. Again, when these cysts get large, you can see how it would push down on that tectal plate and compress that little tiny channel, and their ventricles can enlarge and cause what we call hydrocephalus. This patient does not have that, thankfully. And sometimes if you have a solid tumor here, they can be larger and really push down and compress this little band here, again the tectal plate. That can cause a condition called Pineal syndrome, and that can cause paralysis of upward gaze and other visual disturbances. But with cysts, apparently that's not usually the case. Even when it pushes down, it usually does not cause that. It just causes hydrocephalus. Now this is just another sequence showing the exact same thing. This is that pineal region cyst right there. We can see the Cerebral Aqueduct, or Aqueduct of Sylvius, right there, that little dark channel. Here's the fourth ventricle, and there's that cyst. So a fairly common finding, up to 5% of people. And think about if it's under a centimeter, don't get too worried. If it's nice and simple and clean, if it's over a centimeter, or especially over 1.2 centimeters, you may be worried it could be a pinealocytoma, and those can grow and compress. So it's controversial as to whether you need to follow that or not. You can also give contrast to make sure there's no enhancement, or you just see the thin rim of enhancement like you'd expect. And that's it. So otherwise, normal MRI of the brain, and thank you very much.